Maker behind a new experimental vaccine says its research could be one step closer to making that a reality. Armor Sciences announced this week that early-stage clinical trials on humans showed promising results. How does it work? Well, the company says the vaccine produced antibodies even when taken at its lowest dose, and that patients tolerated it well. Those antibodies essentially train the immune system to recognize and attack fentanyl. As we all know too well, fentanyl can cause a euphoric high. An overdose can happen once it reaches the brain. If the vaccine eliminates fentanyl before it reaches the brain, no overdose and also no high. The vaccine still has many phases to go before it comes anywhere close to being ready to hit the market. But could this be a breakthrough for doctors and for researchers and for families trying to fight America's opioid crisis? Joining us now is Dr. Kristen Gilliland with the Warren Center for Neuroscience Drug Discovery. Kristen lost her son to an accidental overdose after he was diagnosed with cannabis-induced psychosis. Kristen, great to have you back on the show. You are a scientist, a doctor. Explain to me how this works. I hear vaccine, I think virus. I don't think fentanyl.
Right. Well, when we look at the fentanyl vaccine, it's so clever. It's taking a little, like a portion of fentanyl, and then adding on these kind of carrier proteins that have been used in other vaccines in clinical trials. And so what happens is when they make this, they take this fentanyl piece and attach these proteins, it's very large. And when something enters the body that's like that, your body says, attack, attack. It's like a foreign invader, a pathogen, virus. But as it tries to make its way, if we think about basically someone taking fentanyl, what happens is that vaccine itself makes the body produce antibodies to kind of anti-fentanyl antibodies. If fentanyl is taken, the antibodies actually bind to the fentanyl. And then as it tries to get into the brain, it's just too big. It can't get in. So then it basically, you get the reduction in, since it can't get in the brain, no euphoria and no overdose
death. Do you think this could be a game changer for fighting addiction?
So, that's a tricky question. I really look at it as a tool in the harm reduction toolbox. I see it as something that people who are in recovery and just maybe, getting into recovery and where the highest, the highest chance of maybe having a relapse, having this be part of their recovery process is actually getting this fentanyl vaccine. So if by chance they did relapse and it was fentanyl, that they could actually, we could save their life.
This would not remove the craving that people who are addicted to fentanyl feel. Many people take fentanyl not even to get high so much as it is to ward off being dope sick because they're so addicted to it. This wouldn't address any of those issues. It would, in fact, it would keep you, would you still get dope sick, in other words? Would it prevent somebody from having that terrible withdrawal?
No, so you would still have those withdrawals. And that's why, they have other medical assisted therapies like Suboxone or things like that, or methadone, that reduce cravings and reduce the withdrawal effects. But because it can't get in the brain, you're not going to get that euphoria. And basically that's where we see from the dopamine, area in the brain that gives the reward feeling, that that's what causes those withdrawal effects that we feel. And so since it can't get there, you're still going to have them.
Do you think that people will voluntarily take something like this, given the fact that it removes the high, as well as the potential for death?
Right. I think that I think a concern might be that people who have an addiction, particularly there are people with fentanyl addiction, that you build up this tolerance over time where it takes more and more of that drug to actually feel the effect. And those people might need more antibodies than, if they are used to a huge amount of fentanyl, that when they get the vaccine, they actually might not have enough antibodies to fight the amount of fentanyl that gets into their system.
This comes as there are all sorts of studies underway on GLP-1 drugs to treat alcohol addiction. you know, a whole trial is going on right now with people who are slim, who don't need to lose weight, who don't want to lose weight, who just want to not to quit drinking alcohol. And they're studying this, and it's showing promising results. It feels like you're hearing more and more that pharmacology, some of these drugs may actually help with problems that have plagued humanity for centuries, addiction to substances.
Yes, and I think that that's what's beautiful is sometimes we have these side effects that actually are very beneficial to some other type of disease or disorder, whatever it might be. And I think it's wonderful. I mean, I know that it might be a problem for people who are suffering with addiction who may already that definitely might not need to lose any more weight, right, than they have in these GLP-1s. But I have heard great promise from it, and also even in cannabis addiction too. So people are trying it out.
When do you think this fentanyl vaccine, as well as the GLP-1 approval for treatment of alcoholism, when do you think either one of these drugs will be approved and on the market and available for folks?
You know, I think because they're going to try and fast track the fentanyl vaccine. And there's one potential issue in that you can't give a person a lethal dose of fentanyl, you know, in clinical trials. They're giving a third of the dose that would be lethal to an average person.
So we're not exactly sure. We can't really test it the way, you know, RFK Jr. is constantly talking about. We don't test new iterations of the polio vaccine. Well, that's because you don't want to give a child a live polio virus. It would be unethical, and no mother would agree to have their child do that.
Absolutely.
Yeah.
So, but and I think the GLP-1s, you know, I'm not quite sure when those will come out, but I do think that I've been to a lot of drug summits, and it's a big talk there. So I'm really hoping that we'll see some progress.
It's absolutely incredible. Sometimes the wonders of science. Thank you so much, Dr. Kristen.
Thank you so much.
Yeah,
Elizabeth.
great to talk to you again. Have a great weekend.
Thank you for watching. Subscribe below and download our NewsNation app right now on your phone, and you will get fact-based, unbiased news for all Americans.